Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande, would like to welcome you all in this today's interesting video. The title is Roots of Drug Administration. This is the title of today's video. I welcome you all in the Ayurveda Academy channel. Myself is Professor Dr. Rajendra Deshpande. I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. My WhatsApp number is 9226810630. My dear friends, today we will talk about the administration of a medicine. That is the roots of drug administration. How the doctor is giving the medicines to the patient by which route. So the different routes, and that makes a difference in its action. This topic has another significance. One is at the practical level when we do our medical practice. And second thing, the students who are studying in second year BMS in the subject of Dravya Guna Vijnan, they have some pharmacological topics in their syllabus. And one of these important question is asked in the second year BMS Dravya Guna Vijnana subjects question paper. Describe roots of drug administration. My dear friends, administration of a medicine is very clinically important topic because whether a drug will reach to the intended site of action in the body is depend on two factors. Number one, bioavailability of the drug, how much drug is absorbed, and second, which route is chosen for particular administration of particular medicine. So let us further see which are those routes. So you can see we will start with these tablets and capsule and all these things. First is a oral administration. Huh? Before that, I would like to show you the routes of administration, totally important 5 routes. Each route is having its associated advantages as well as disadvantages. Oral route by mouth, sublingual, here sublingual, below the tongue, rectal, topical, and parenteral route, which includes intravenous injections, intramuscular injections, and subcutaneous injections. So this we will start with the oral administration. This is the most convenient and economic for everybody, for the patient, for the doctor. Solid dosage form such as the tablets and capsules have a high degree of drug stability. It can be preserved for a longer time, shelf life, and provide accurate doses for the administration. Simple example that we consume tablet paracetamol or the crocin, that for reducing the fever, antipyretic. The oral route may be problematic. Sometimes it can be the problematic because of unpredictable nature of the gastrointestinal drug absorption, because that has to go to the duodenum, first to the stomach, then duodenum, jejunum, ileum. If there are any problems in your digestive system, then that can affect the oral administration, absorption, and the bioavailability. So, for example, the presence of food in the gastrointestinal tract naturally changes the gut pH, acidity and alkalinity. It also changes the gastric motility and emptying time, as well as the rate and extent of drug absorption. So sometimes there should be food in your stomach and sometimes there should not be food in your stomach for considering oral administration. For example, capsule rifampicin, which is the best drug for tuberculosis, or tablet roxithromycin, best antibiotic, should be taken before food. Very important. But NSAID, what non-steroidal anti-inflammatory drugs, which we always take for backache, arthritic problems, that should be taken only after food, after lunch, after dinner, because otherwise it will start peptic ulcer and gastritis, drug-induced gastritis, if the patient consumes tablet Voveron, tablet Combiflam on the empty stomach. So some medicines should be taken on empty stomach, should be taken after food. Tolerance. varies in very young and older patients. Children, they don't like to take tablets or capsules. They cannot even engulf that particular tablet and capsule. Same is with the condition for the old people. So for the children and for old people, in spite of tablet and capsule, for oral administration, we use the liquids or soluble formulations are very useful. For example, the adults can take tablet crocin paracetamol tablet, but in children we have to use syrup crocin. Similarly, for the young man, we can use, for young woman, we can use capsule or trim for the anemia patient. But for the old people, we must use dexorange syrup for to treating the anemia. Now, in the oral tablets, there are different, what you can say, the progress. There are now modified release formulations. Modified release, how that tablet should disintegrate in your GI tract and how it should be made available, bioavailability. That process can be delayed. So prolonged drug delivery is possible. This maintains the plasma drug concentration for extended period above the minimum effective concentration. So slow release tablets. SR, for example, tablet Voveron SR, sustained release, may take care of osteoarthritis for 24 hours. Only Voveron SR in the morning, finish. No BD, no TDS, no 2 times in a day, no 3 times in a day, only SR, sustained release capsule. If you take the plain Voveron, then one morning, one afternoon, one evening. But SR has a long time of action. Main advantage is that the doses usually only need to be taken once or twice daily. Voveron SR in the morning after breakfast, Voveron SR at the dinner, after dinner, and for the night problem. Okay. Second, sublingual route, below the tongue. The sublingual mucosa offers a rich supply of blood vessels through which there is blood vessels through which drug can be absorbed. This gives rapid absorption into the systematic circulation. The most common examples of sublingual administration is glyceryl trinitrate. Glyceryl trinitrate NGCD tablet in the treatment of acute angina pectoris, heart pain due to the exertion, immediate relief. If you take, that is also called as a therapeutic test. If the patient gets relief after taking the rest and sublingual glyceryl trinitrate NGCD tablet, then that can be the angina pectoris problem. If the patient is not getting relief after rest for 5 minutes, after taking sublingual NGCD tablet, then there may be some another causes for the chest pain. Now, you can see sublingual route. Capsule depine, another example. This you have to break the capsule and pour the liquid to reduce the blood pressure urgently. For example, 120 by 80 mm of Hg is a normal blood pressure. If that diastolic blood pressure is above 100, above 110 mm of Hg, above 120 mm of Hg, capsule depine for immediate sublingual absorption is very fast. Another example, olanzapine. Olanzapine is used to treat schizophrenia, psychological problem, to be administered sublingual route that can be used for olanzapine. The third is the rectal route. The rectal route has a considerable disadvantages. The people don't like it, rectal route, in terms of the patient's acceptability and unpredictable drug absorption. It is valuable for localized drug delivery, local action into the large bowel. For example, the use of rectal steroids in the form of enema or suppository. I'm sorry, there is a printing mistake. If your kind permission, I can correct over here the spelling. The spelling is suppository. I'm sorry. So, suppositories in the treatment of ulcerative colitis or constipation. Steroids are used for the ulcerative colitis. Suppositories, glycerin suppository is used for the constipation problem. This is maniquin. That is a example of how the glycerin syringe is used. Glycerin is poured into the rectal region. Paracetamol suppository to the rectal route can be used to treat patients with pyrexia who are unable to swallow tablets. Very in emergency or in children. Glycerin suppository for constipation in the children. Ayurvedic, all the bastis, Anuvasana basti, Asthapana basti, is an example of rectal route administration. Now, fourth, topical administration in the management of localized disease. As the systemic circulation is not reached in great concentration, the risk of systemic side effects is very much reduced in the topical administration. No systemic problem because it is less absorbed. It is absorbed only locally and local action. No blood, no heart, no liver, no brain, no problem. For example, the use of eye drops containing beta blocker in the treatment of glaucoma. That intraocular pressure is raised and severe headache, severe eye pain is there. The application of topical steroids, that is clobetazone ointment in the management of eczema dermatitis. See, you can see the eye drops. The use of inhaled bronchodilators in the treatment of bronchial asthma. Puff, the insertion of pessaries containing clotrimazole in the treatment of vaginal candidiasis. 2% xylocaine ointment before the food for the after only 2%. Remember, xylocaine ointment only 2% for local application for the aphthous ulcers. Xylocaine ointment higher percent locally for fissure in ano in Ayurveda Parikartika. Now, when you give some application, try to understand there may be local skin reaction. So be careful. Even Ayurvedic Paribhadra Taila prepared from the Azadiracta indica nimba that can cause the allergy to some patient by getting some papular rash because of sulfur in the Paribhadra Taila. Topical inhaler, for example, oral puff. I am giving you direct ready-made treatment for mild intermittent asthma, asthalin or salbutamol 2 puff stat and then 2 to 3 times in a day with inhaler or rotahaler. If there is a mild persistent asthma, then steroid Beclet 500 milligram BD inhaled with inhaler or rotahaler. My dear friends, Beclet inhaler in asthma is very much important because you can avoid the systemic side effects of prednisolone tablet if you give orally. When you give orally, there may be systemic side effects. But for the inhalers, there is no systemic side effect. That is the most advantage of topical inhalers. Nebulization for asthma, nebulize with asthalin and apravent solution for the children. See, you can see bronchial asthma inhalers. Last, fifth is a parenteral administration. Any non-oral means of drug administration, that is the injections directly into the body. When you give this injection, that bypass the skin and mucous membrane. It is not entering into your body. It is not applied. It is not going internally through the gastric mucosa, intestinal mucosa. It is not applied to the skin. This is another route that bypass skin and mucous membrane. The common routes are parenteral administration are intramuscular, subcutaneous, for example, insulin for diabetes mellitus, intravenous fluids like saline, dextrose, ringer lactate, metronidazole, etc. Injection Voveron, very famous, 2 ml stat for renal colic. Injection Riglan, 2 ml stat to control vomiting. Injection Terbutalin, that is Bicanil, 1 ml subcutaneous for asthma. Injection aminophylline, 250 milligram diluted in. Now remember, some injections must be diluted. Remember this thing. This is something different than the oral route or the topical route. This is complicated. Parenteral route is not so easy. You have to be very, very careful. So aminophylline 250 milligram diluted in 20 ml of 5% dextrose IV very slowly. Aminophylline should be given very slowly in asthma. Injection adrenaline, very emergency management, 0.5 milligram subcut in severe asthma. Adrenaline is an emergency management drug. It is equally important and equally dangerous. Remember my words. Adrenaline can be life-saving. Adrenaline can be life-taken. The person can be alive without death or patient can die. For example, if adrenaline is given without any care in the patient's less than, more than 40 years of age, if the patient is suffering from cardiac problem like fibrillation, he can die. So adrenaline should be used below 40 years of age and not after 40 years of age for bronchial asthma. Remember my words. Subcutaneous injection site. You can see here lateral aspect of the lower arm. Then this is abdomen. This is thighs. These are the areas of subcutaneous injection sites. Advantages. Drugs that are poorly absorbed from the oral route, inactive or ineffective if given orally, that can be given by injectable route. The intravenous route gives the immediate, instant action. I will give one example. If there is hypoglycemic coma in the diabetic patient, blood sugar level is less than 60 milligram per 100 ml, and the patient drowsy, slurred speech, is becoming drowsy and comatose, then what do you have to do? Instant IV glucose, the patient becomes immediate fresh. He can survive. If the blood sugar goes below 40, 50, 30, patient can die at any moment. Hypoglycemic coma is more dangerous than diabetic ketoacidosis. Remember my words. Their IV glucose is a life-saving drug. Instant. No oral, no problem. The intramuscular and subcutaneous routes can be used having slow or delayed onset of action. We don't have any emergency. Then no IV, only you can give the IM, intramuscular or subcutaneous. Patients' compliance problems can be largely avoided. That means if you don't believe that the patient is taking oral medicines, for example, for anemia, we are prescribing, but he is throwing away your ferrous fumarate tablet because it looks like a black color. Yes, it is happening. In the rural areas, the ladies, pregnant ladies, they throw away the ferrous fumarate tablet. You will be surprised to know iron tablets because they feel the tablet is black, my child will be black. Very, very gross misunderstanding. And then in these cases, those who are not following your proper advice for the oral route, injectable is the best route. Here you can see saline. Disadvantages. This particular any parental route required the trained staff, nurses, doctors, every should be very well trained. These treatments can be costly. It may be sometimes painful, and much important is aseptic techniques are required. Sometimes there are supporting equipments like programmable infusion devices for insulin. For example, it is required special instrumentation. Caution. Use appropriate injection technique. For example, Z technique is used for giving iron injection, interferon. Using the wrong sized needles can cause damage to the nerves, muscles, and vasculature. So it can be iatrogenic problem. Remember my words. It's very, very careful for giving the injectables. Injection of the drugs into the muscle or the adipose tissue beneath will be released gradually into the systemic circulation over a period of time. So intramuscular is always slow acting and intravenous is very quick action. These particular sites are very important. Deltoid muscle, and following you can see here injection site. This is more important. Can you see over here? This particular area you have to do. This is gluteus maximus, and the most important, this is sciatic nerve. If any time nurses, doctors, they give injection over here, especially in the previous years, it was happened. Given injection at this particular site in the rainy season can damage that sciatic nerve permanently. Even before that, the polio is getting because of the wrong site and wrong season. So my dear friends, be careful while using the parenteral route. Actually, IV route is inconvenient for the patient and practitioner because it causes the greatest risk of any route of drug administration. On all, IV is the most difficult. Such administration is frequently complex. They require dose calculations, dilutions, etc. IV route requires most aseptic precautions. Consider some points before giving IV route. Is the drug suitable for direct injection or it must be infused over a time like aminophylline should be given very slowly. Whether the drug causes any local reaction. Some, especially I warn you, 3 injections, penicillin, interferon and B1 thiamine, that is polybion, neurobion. These injections before giving should be given test dose. After sensitivity test, AST, only injection you can give. If any doctor take a risk, then there may be anaphylactic shock for injection penicillin, injection interferon, and injection neurobion because of the B1 thiamine and not because of B6 and B12. That is B1 can cause anaphylactic reaction. Okay. Finally, whatever the medicine that I am saying is only for the educational purpose. Self-medication I always discourage. So nobody should take the direct themselves particular medicines. Okay. So my dear friends, if anybody wants PPT as per demand, audios as per demand, or videos as per demand, they can definitely contact myself, Professor Deshpande, on 9226810630. I wish you all the best. And I request all of you, please subscribe my YouTube channel and share this video, like this video, because your every feed is encouraging for me, boost for me. Routes of administration is very important topic for Dravya Guna Vijnana question paper. So this is one of the answer of one of the important question in Dravya Guna Vijnana question paper. So my dear friends, I wish all the best. Take care. All the best for your exam. All the best for your practice. Thank you.